simple chores, picking up a light thing from the ground, sometimes sneezing loudly, or maybe just making a wild turn while talking to somebody. Why does this happen?
Have you seen deadlifters or powerlifters lifting like 500 kgs of deadlift, like 1,000 pounds? What about those manual laborers who are working day and night, but they don't have back pain? It's the fact that the spine is made to take the load and it keeps getting stronger if you keep loading it.
But people with back pain, they often fear that their spine has been damaged. How true is that?
So 5 rules to get rid of the back pain. Number 1.
Did you know that back pain that goes away with rest and painkillers can be very bad news? Most people are killing their backs and delaying their own recovery. We as doctors worry the most about those patients who tell us that their back pain is manageable. On today's podcast, we are going to shatter the myths and the mistakes that most people are making with back pain. Hi, I'm Dr. Nivedita.
And hi, I'm Dr. Chandril, and we are both American board certified doctors. Welcome to today's Dr. Good Deed podcast. This is a platform where specialists from different fields like modern medicine, Ayurveda, herbal medicine, naturopathy come together to answer the questions and concerns you have. We have one job here, to cut the clutter and bring you the right medical information. So welcome.
In your experience, what is the most common mistake people with back pain are making, which is making their problems chronic?
If there was one big thing that I would not let my patients with back pain do, is rest.
Really?
Yeah.
That is going to shock people because everybody is told to rest. Why is that a problem?
A lot of people are told to rest, and that was old advice. Research has shown it conclusively that the more you rest, the more chronic or long-term the pain begins to be. What happens is that when you start resting, your muscles become deconditioned really fast. And when muscles become deconditioned, they take a longer time to heal. Those injured muscles need a lot of circulation, the circulation of blood, nutrients, oxygen to those areas. And it will only come with gentle movement. So rest is a no-no in today's world.
So what you're really saying is that basically the muscles kind of begin to sleep and they start dying when we don't make them work a lot. And that is why rest can be very bad for people.
Yes.
This is going to become, I think, the most shocking thing for most patients. But I want to ask you, what else is it that people are doing wrong that the back pain is becoming worse?
See, one big factor that psychologically affects people with back pain is fear avoidance. Now, what is that? So once you start having pain again and again, you associate that fear of pain with any movement you do. All your movements become guarded. You're very careful moving, bending down, picking up weights, and that is not the natural way the body behaves. So your body learns to anticipate pain, and it's always on the alert or under a stress mode. And this prolongs the back pain because your body is now trained to anticipate pain, even with normal activities that would have not led to pain before. And when the pain stays there for long, you bet this is not going to be easy to heal.
Wow, I understand that most patients actually are very, very scared, like you said, because they know that a particular movement is triggering the pain. I think the natural psychological response is that let me avoid that movement. But what you're telling us is that in itself is making the back pain chronic.
Yeah, you're training yourself. It's like you keep lifting weights, you get bigger muscles, and you keep anticipating pain, and you keep suffering from the pain, and your body learns to anticipate pain, and the pain becomes a daily normal.
Doctor, most people say that they get taking treatment for back pain, but the pain keeps coming back. Why does this happen so often?
Well, a lot of people take a lot of pain medicines and their pain goes away, and that's where they stop. They forget that they also have to fix the recurring causes of back pain, and that is why a lot of people falter and the back pain keeps coming back.
So basically, I've heard people take painkillers, they go to physiotherapy, they're even taking injections, but the pain keeps coming back. Does this mean that the treatment is failing?
No, that is not a failure of treatment. There are two big factors that would determine if somebody gets rid of their back pain or not. See, one of them is, let's say you have back pain and you took medicines, but you were not explained the goal clearly, why the back pain happened, what made the back pain happen, what to do continuously in your life so that the back pain wouldn't happen. So it's not laziness that determines if a patient is going to get better or not. It's actually lack of clarity on the treatment side. Education is lacking. So the patient never gets out of the treatment with a clear understanding of how to treat the back pain. Most people think that back pain is just today's problem problem and needs to be fixed periodically rather than understanding that your back needs continuous maintenance. The second thing is psychological. If you keep having back pain again and again, you will at the back of your mind will always be worried of the next occurrence. And this vigilance, this stress is itself a psychological trigger of back pain. These two things lead to chronic back pain.
It's so interesting that it's not that the treatment is failing, it's lack of education perhaps on the part of the provider and on the part of the patient in understanding what caused the back pain.
Right.
And like you said, fear is the biggest factor. Because of fear, there is this psychological thing that goes on into the mind of the patients, and that perhaps leads to worsening back pain. So viewers, if any of you have been experiencing back pain and have been through so many treatments, please write yes in the comment section. People with back pain, they often fear that their spine has been damaged. How true is that?
That is the number one concern people have nowadays. Well, if you look at the spines of people more than 40 years of age, you will figure out that they have some amount of disc disease and they have some nerve compression and there are some degenerative changes in the spine. Almost everyone has it. That doesn't mean that your spine is getting damaged. The biggest thing that people need to understand that your spine is not delicate. It's not fragile. Have you seen deadlifters or powerlifters lifting like 500 kgs of deadlift, like 1,000 pounds? What about those manual laborers who are working day and night, but they don't have back pain? It's the fact that the spine is made to take the load and it keeps getting stronger if you keep loading it. But we do not exercise our spine or we do not take enough load for our spine to get stronger. So it's not the load that you're picking up, it's just that you're picking up wrong and you're not training your spine to go better and better every day.
Wow, so what you're basically telling us is that your spine also undergoes a little bit of wear and tear, just like a brand new car, which if you keep driving, is going to keep undergoing wear and tear. And not every back pain means that the spine is really damaged. I think this is the biggest thing that you've told us today. So I want to ask the viewers, if you know someone or you yourself have been suffering from back pain and have been worried that your spine is being damaged, please write damage in the comment section. So I want to ask you one thing. So is it possible for normal people who don't have back pain to still have these changes in their spine?
Absolutely. You will see on the different scans of different people, a lot of them who never have had back pain, that they have disc bulges or they have degenerative changes in the spine. That doesn't mean that somebody has back pain.
Wow.
And you will see spines that absolutely look normal, but those people still have back pain. So you have to put it in the clinical context, the picture. I mean, just the image or just the finding on the imaging doesn't determine if you will have back pain or not. There are a lot of other factors at play.
Wow. So basically, even if the MRI is showing that I have disc disease and I don't have symptoms, my back is healthy.
Correct. But don't forget to take care of that back.
Of course, of course. So doctor, let me ask you, where is this back pain coming from?
Well, most of the back pain is actually not coming from the spine. It's actually coming from the muscles, the soft tissue surrounding the spine. It's the tightness of the muscles, the injury to the tissue, supporting tissue of the spine, and the weakness of the core that causes the maximum back pain. But what is very interesting that the research is showing us nowadays, that actually the brain gets the pain signal not only from the damaged tissue, but also from your mood, your stress, your sleep quality, the context in which the injury happened, and the environment that you are in. And brain puts all of that together to cause pain. And that is why when you see the same physical findings causing pain in one person, but nothing in the other, because it's not just the tissue injury that's causing the pain. The other thing that's extremely important is that people who have chronic back pain, they become hypervigilant and their pain alarm is turned up so high, not just because of tissue injury, it's because of all the other psychological factors, that they are even sensitive to the smallest stimuli which can cause pain, right? And so when people say it's all in your head, it's actually not true. It's a proven biological phenomena.
Very interesting. So basically, even when the spine is not damaged, there are many other factors, including your muscles and your brain, that are tricking you into having more and more back pain. And it's like a cycle that is very hard to kick.
Back pain is not just physical. It's actually an emotional phenomena as well.
Wow. Well, viewers, if you are liking this podcast so far, please don't forget to like and subscribe to our channel. Most patients with back pain, they stop exercising once the pain goes away. Is that a mistake?
That's one of the biggest mistakes that people do when they stop their exercise regimen as soon as their initial rehab is complete. You know, you'll be surprised to know that once you stop exercising, very quickly the muscle degenerate. See, when the pain goes away, that doesn't mean that the underlying disease or underlying vulnerability has been taken care of. The pain goes away because the inflammation goes down, the swelling goes down, the nervous system calms down, and the muscle spasm gets a relief. That's the only reason the pain goes away. But that doesn't mean that the injury or tissue damage that has happened has actually recovered. The research has shown that the spinal stabilizing muscles, once they're injured once, they take a long time to recover and continuous maintenance. And if you don't pay attention to it, you're just walking with a weaker spine of what you had before.
So the biggest mistake people can make is that they are calibrating that their back is getting better just because the pain has gone away and they have stopped exercising. What you're telling us is that the muscles supporting the back are going to take way longer time to get better, and the same patient who stopped exercising can get the back pain again in the future.
This is exactly what happens in real life because we forget to exercise thinking that the pain is gone, so the problem is gone. That's like a normal thinking process. But what the body needs is constant maintenance of the body, because see, your spine is holding your entire body every day.
Exactly.
It doesn't get a rest. So if you don't take care of your spine every day, you're walking with a weaker back with every episode of back pain.
So doctor, please tell us, then how does exercise help?
So one is very obvious, that you're training your muscles to be stronger, but there are much more important aspects of exercising that we never talk about. See, your spine, your discs, they are not directly supplied by blood vessels. So you need movement and you need exercise to improve circulation in those areas so that those areas can get the nutrition and the healing power of oxygen. But we forget that. The second thing is, the exercise is not only making those muscles stronger, the exercise is also sending a signal to the brain that the body is getting stronger. So psychologically, you're winning the war against back pain because you're loading your spine and you get the confidence that you're getting better. Then number 3, it helps with sleep. It helps with stress reduction. Both of them are big factors which cause back pain. So it's not just getting stronger. There's a lot of psychological and nutrient aspects of exercise that we never discuss.
So exercise isn't just about movement. It is taking care of both your physical and mental well-being, all of which is going to make the back pain better.
Absolutely.
Most people today are working from home. That involves them sitting for long hours, whether they are in sedentary jobs or in information technology. How does this affect the back?
Well, a lot of people think that when you're sitting down, your spine is not loaded. But you'll be surprised to know that there's less pressure on the spine when you're standing up than when you're sitting down. There are multiple studies which show that when you sit down, especially if you're like a little slouch, when your back is not erect and you're bending forward, your discs get compressed at a much higher pressure. And this, over years, becomes a problem for the spine, and that is why you have back pain in sedentary individuals.
I want to ask you, most people, they end up getting back pain not because they're lifting heavy weights or working out at the gym. It's simple chores, picking up a light thing from the ground, sometimes sneezing loudly, or maybe just making a wild turn while talking to somebody. Why does this happen?
Well, you bring in a very important point. People think that they need to lift weights and that is why they actually injured their spine. That's absolutely false. A lot of people with trivial stuff like sneezing you mentioned can get back injury, and that happens because over the years when we have been sitting on our butts, what is happening is that the muscles which support our body at the back of the body, which are your spinal muscles, your hamstrings, your glutes, they're getting weaker, and when they get weak, they cannot support their spine, and to compensate for it, the muscles in the front of the spine or the hip, known as the hip flexors, they shorten. And when they shorten, they put your spine at a very risky space. It's like a forward tilt of your pelvis. And when that happens, the injury is like, you don't need to do anything. And the spine will snap. And that is the reason why back pain is so common. We've forgotten about the hamstrings and the glutes.
So back pain isn't just about the muscles in the back. Actually, your hip and your thigh muscles may have a very important role to play in you getting that injury.
In fact, I personally believe that these are the two most important muscles that can cause back pain, your glutes and your hamstrings, more than your even back muscles.
Wow. Well, viewers, if any of you have sedentary jobs that require you to sit for long hours and who have been suffering from back pain, please write back pain in our comment section. Some people say they slept and then they woke up with back pain. Why does that happen?
See, when you sleep, all the spinal support muscles are relaxed. So your spine is basically at the mercy of your bed, your mattress, and your pillow. And when you wake up, these muscles take a little time to kind of get into the rhythm. And so it's a very vulnerable, very sensitive time for the spine to just bounce back and start loading up. That's why a lot of people feel pain in the morning when they wake up. The second thing is, in the sleep is when your rehydration of the discs, repair of the discs is happening and your spine is getting decompressed. That is the reason why you're slightly taller in the morning rather than in the evening, about 1 to 2 centimeter difference, because your discs become plumb with water. This is very healthy for the discs, but it is also a very sensitive time for your spine because it's going through a repair process. That is why the mornings are a little worse than the evenings are.
So then tell me one thing, what is a good sleeping posture to make sure we don't get back pain?
See, there are 3 ways you can sleep. One is on the side. So see, if you're a side sleeper, just make sure that your mattress is not very soft so that you don't sink into the bed, and use a pillow between the knees so that your spine doesn't rotate and so that it doesn't put extra pressure on your discs. The second thing is, so if you're a back sleeper, just make sure that you use a pillow that is under the knees or under the thighs so that your back muscles get a relief. They are not under spasm, not under stress. And when you wake up in the morning, you'll feel like a new person. The worst position that you can find out to sleep is when you sleep on your stomach. That you should never do. See, what happens is it puts your spine in a very, very delicate and sensitive position. And that is a big cause of back pain. On top of it, when you're sleeping like that on your tummy, you tend to move your neck right or left to breathe, and that is not good for your cervical spine either. So that's why a lot of neck pain and back pain happen to people who sleep on their tummies. So never do that.
So very important sleeping postures, back sleepers are good, side sleepers are good, and use pillows between the knees and the back. That is going to make the spine a lot more straight and rested. Excellent. Brings me to the next question. What about the mattress? What kind of things should I be looking for in a mattress to make sure I don't get back pain?
Yeah, isn't that a golden question?
Absolutely.
So how do you choose a mattress? So if you have a back pain, just remember, choose a mattress, first of all, that's not too soft. You don't want to sink and drown in the mattress. The second thing is, if it's too hard, it's too firm, there will be a space between your lower back and the mattress itself, so your back will not relax. So remember that choose a mattress which that kind of follows your spine curvature. So it could be a medium to medium firm feel. The second thing is, don't use a mattress for like 20 years. See, most of the mattresses lose their efficacy with 8 to 10 years. So if you have a mattress that's been going around for generations in your family, this is the time to throw it off. And don't fall for those marketing gimmicks about 20-year warranty, because they're useless after 8 to 10 years. That's how you pick a mattress.
So 2 things we need to remember. Mattress needs to be medium to medium firm, and we have to make sure we are changing the mattress every 10 years. Okay, so the next thing is, what about a pillow? What is the right pillow to make sure that my back is aligned in such a way that I'm giving it enough rest when I'm sleeping?
Well, I guess the way you pick a pillow is very subjective, but on top of it, just remember these few things. So don't pick a pillow that lets your neck drop too far back or bent too far forward. So an ideal pillow height for somebody who sleeps on their back, as a back sleeper, is about 3 to 5 inches. And if you sleep on the side, you need a little extra. It's about 5 to 7 inches. Just make sure that your neck is in the same line, neck and head is in the same line as the spine is, so that there's no pinching of the nerves at night and there's no stress on the muscles.
That's excellent. So we have to make sure we are using the right pillow, the right mattress, the right sleeping posture to have that beauty rest, so our back is always protected.
Perfect.
You know, doctor, we all know obesity or being overweight is an epidemic in the world. And we all know that being overweight leads to back pain. But I want to ask you, what is the minimum amount of weight that I can lose that my back is going to say thank you to me?
Well, you'll be surprised that the studies have proven that if you lose just 10 pounds, like around 5 kgs, that is when your spine will start thanking you like anything.
Well, you know, I think most viewers who are listening to our podcast are going to be so happy hearing this, because 10 pounds or 5 kgs is a very doable goal.
It's a very achievable goal.
Absolutely. And just with that, we can get rid of back pain. Isn't that amazing?
It is.
So if someone has had back pain for 5 years, tell me any 5 rules that they need to follow to get rid of the back pain.
So 5 rules to get rid of the back pain. Number 1, stop treating your pain and start getting stronger. Number 2, train your nervous system. And by that, what I mean is your sleep needs to be optimized and you need to manage your chronic stress. Those are 2 big triggers of back pain. Number 3, build a strong posterior chain. Forget about the core for the moment. Focus on glutes and hamstrings. You got to do deadlift, posterior chain work, and single leg work under supervised environment. Number 4, increase the protein intake in your body. I cannot stress this enough. You need a lot of protein to build muscle and to have a strong life. Number 5, invest in a good mattress and a good pillow. This is going to change your life forever.
So, doctor, I'm going to start with some rapid fire questions, okay? So, tell me, which vitamin deficiency causes back pain?
B12 and vitamin D.
Okay. What life-threatening diseases can present with back pain?
2 most common diseases that can actually present with back pain is prostate cancer and multiple myeloma.
What multivitamins are good for back pain?
Vitamin B12, B3, and vitamin D.
Okay. What drinks are very good for back pain?
Any drink that would contain ginger and green tea, something with turmeric and milk, and the last would be tart cherry.
Is walking good for back pain?
Walking is extremely good for back pain, especially if you do Nordic walking.
Name one exercise which is going to be very good for back pain.
I usually like to focus on the posterior chain, so glute bridges and pelvic stabilizers or pelvic tilts.
Which sleeping position is best for back pain?
If you sleep on the back and if you sleep on the side, it's okay with the back pain, especially if you use a pillow to stabilize your spine. Otherwise, never ever sleep on your tummy.
What is the success rate of having a back surgery or a disc surgery?
So back surgery is usually successful from anywhere to 70 to 90%. However, there is a decently high failure rate as well.
Which pain medicine is best for back pain?
Well, if you're taking a pain medicine for back pain, I would start with something like naproxen or diclofenac.
Thank you so much for joining us today. If you like content like this, please don't forget to like and subscribe to our channel. Until next time, thank you.